morning, good evening, what time zone it is, I don't know. I hope there are many time zones. I have 10 a.m. o'clock. Thank you, Bartosz, for organizing this conference. I think it is very important to do such an event. And thank you for the opportunity to talk about a very important topic, and I think a little unknown topic. Because I'm going to talk about the people who do not exist, because they are not diagnosed, so they are not in the system, but not diagnosed medically. So I'm talking about the people who are not diagnosed. They don't have diagnosed medical conditions. So, first of all, I would like to introduce, I can recognize some people and faces and names. Hello. I'm going to talk about myself. I'm a psychologist, I am an act therapist, I have my private practice, I work in Polish and English language, mostly online, and I'm honored to be a vice president of Polish ACBS chapter. I don't know how many of you are now, but if you would like to take active part in the experiential exercises, I invite you to write yes in front of your name, just to give us information that you will take part, active part in Zoom rooms. So please, if you are really interested, and I am inviting you to be active, please write yes at the front of your name. If you don't know how to do it, just write on the chat that you are interested. People who won't write it will not be included in the rooms. The plan of the workshop, I will talk about undiagnosed disease definition, about delayed diagnosis, about rare diseases, about the problem, should we believe the symptoms of the patients, about psychosomatic diseases definition, and also ACT interventions in treating undiagnosed clients. And it will be a small summary and maybe discussion. Undiagnosed diseases, why they are undiagnosed? Okay, they can be undiagnosed because it's a delay. And delay can be because it just takes time to diagnose, or all the tests are negative. So the patient has symptoms, but there is no proof on the medical test. It's just the patient is complaining and suffering from some symptoms that the doctors cannot measure. Also, it can be a misdiagnosis, and the misdiagnosis happens quite often. There are statistics showing that it's 1 in 5. The symptoms of disease can be linked to the disease already diagnosed. And that's also a trap, because if somebody says, oh, I have this new symptom, and if the doctor knows that the patient has already a disease, oh, because you have this disease, and they are not searching for explanation for the symptom, and there is a mistreatment. Rare diseases, yeah, rare diseases are rare, and the doctor maybe thinks about the rare diseases, maybe it is possible, but they say, oh, it's rare, so I want to check it out, rule it out. And also there is missing knowledge of the rare diseases, because there are too many of them. It is not possible to know all of them. And we have the problem with pandemia at the moment. So in most countries, there is a rise of delays of medical diagnostics, because there is overload of the medical care system. So we expect more people having undiagnosed diseases at those times in some countries, in most countries. And what is the probability of having an undiagnosed patient in the therapy? It's hard to estimate, because those people are not included in statistics. Nobody writes, oh, the patient has a disease, but we don't know what kind of. It's It's not often like this. I will talk about it later. I will use examples. There is a disease, endometriosis, which affects almost only females. Most commonly, it occurs in lower abdomen, pelvis, but it can appear anywhere in the body. Symptoms include lower abdominal pain, pain with menstrual periods, pain with sexual intercourse, difficulty getting pregnant. And it is very common disease because it's 10%, 1 in 10. It is really very common disease. If we have 10 women now on our workshop, one mostly, it is possible she has it. And this is very strange thing because the delay from the first symptoms to the diagnosis is from 7 to 14 years. It's quite a lot for such a common disease. And I don't have place now to explain why it is happening, but it is really happening. The data, the statistics do not lie. And when we look at those numbers, 7 to 14 years, it means that the patient at that moment suffers from the symptoms, but doesn't know what is happening and has a lot of problems. She because it's endometriosis, so she needs support, she needs help, she is confused, and maybe she will be sent to the psychotherapy or psychiatrist to get help at that moment. So the probability that we will get that kind of client or patient is higher. Okay. Again, I'm. How many people do we have at Bartosz at the moment?
Excluding us, 5, and 2 of them said yes to the breakout room.
Thank you for saying yes. Okay, so if the group is so small, I would like to. I don't want you to be divided to the rooms because there is no point. Let's start with a little grounding exercise, and then I will ask you to imagine something. So please sit or stand, but try to close your eyes. Notice your body. Notice the position of your body. Are you sitting? Are you standing? Check if you feel gravity. Where do you feel gravity in your body? All over your body. In some parts, it's stronger. Check it out. Where is it? Shift your attention to breathing. Notice that there is a moment, a phase of your breath that gravity helps. Try to notice this moment, this phase, when there is no effort. It's just gravity doing its job when you are breathing. Now try to shift your attention to the sounds. First of all, you can hear my annoying voice, but you can also hear some other sounds, maybe something far away. Try to extend your attention from the closest sounds to the farthest, which you can hear. If you manage to make this attention bubble big, I want you to come back to breath. Take a 3 deep breath. And don't open your eyes. Just stay grounded, I hope. I want you to imagine that you are at work with a client, patient. It's a woman. She's 30 years old. She was referred to you by GP doctor. She's tall, long hair. It's a 6th session with her. And she's still tense. She's complaining that she cries alone a lot. Her story is she came to you on the 1st session because she was told to be hypochondriac. The doctor tells her there is nothing wrong with her. She's told that she has depression and that she should undergo therapy. She has days of fatigue, pains in the body. She gets anxious. She has some digestive issues, having recurring low-grade fevers, and her symptoms come and go. She has days when she feels completely okay. The stress worsens the symptoms. The relaxations doesn't work so much on her. She doesn't look sick. She searches internet a lot for diseases because she thinks she has some diseases. She hates going to doctors. Family is tired of her complaining. Nobody understands her. I want you to notice your body and yourself in this situation, that you have that client patient in front of you. What do you feel? What emotions? What thoughts? Is your mind busy? Is she annoying? Are you bored with her symptoms? Do you feel hopeless? Whatever comes, just notice this. I hope you managed to imagine that situation. Maybe you had such a client. You have. Is there anybody who would like to share what happened in that exercise? I'm trying to widen to see more people.
You can either write in chat or you can ask for me to give you microphone permission.
Yeah.
And in the meanwhile, I focused on the digestive issues, and a lot of people have very varied problems that are not easily solved by medicine. So what I feel to her is a lot of compassion, because I can relate her to some of my friends who I know well and who have really big problems that are not well treated, they are not well understood, and they are trying some experimental therapies. So what I like noticed in my mind, I was navigating more towards kind of like a supportive sessions. I want her to feel well, at least how to say, connected with me, not alone with her issues, because I do not think, and this is maybe my looking for certainty in my mind, I do not think this will be easily solved by a therapy, but maybe some of the symptoms, some of the inflammations and so on could be alleviated in some way. I don't know, but these were my first reactions.
Yeah, thank you, Bartosz. Yeah, it's lovely that you can see her loneliness in this, right? And that she needs to be noticed, to be validated, and to be supported. Is there anybody else who would like to share? Oh, Car, please, of course. I know it's early in the morning.
You can now unmute yourself, I think.
Yes, okay. Thank you. Mm-hmm.
Yeah. I felt a sort of contraction in my own chest, and but I was sort of trapped with her in a way, and I felt the hopelessness and the helplessness in this, and I hope I could sort of stay, sort of slow everything down, stay with her, and being someone that could sort of view the situation together with her from a certain perspective, and help her at least with that, to sort of diffuse a little bit, to being the context and not the content of that hopelessness or helplessness.
Yeah, thank you, Carl. Yeah, it's beautiful that you notice this hopelessness, yes, because it's the main issue. This is the funny thing is that she feels the same, right? And it can be very uncomfortable for the therapist to feel it. But this is the situation, little hopeless, right? And we can be trapped by many things. Are there any other people who would like to share their experiences, or I will sum up? But going back to you, Carl, it's also beautiful that you want to be with her, right? It's similar what Bartosz said, that both of you want to make her not to feel alone, right? To be with her, and I am happy that you have this inside you, because for sure she needs that. But let's go back to the traps, right? We can be annoyed. She's not getting better. We can get tired. We can get, we feel hopeless. This is what you said. We can be angry at the client. We can blame client for symptoms. You are not doing well. You are not taking care of your health. We can treat the client as a problem to solve. We can be hooked by the idea of hypochondria and fight with this. And don't search internet. Don't check anything. Live your life, right? All those things can, but they don't, I know, because you are a good therapist, but all those things can lead us to invalidation of the experience of the client. And that would be very, very sad, as you know. Okay, let's go to the video I want to share with you. But before I will share it, there is another idea. I would like you to, when you are watching this, while you're watching, imagine that this is your story. Okay? Try to watch it and imagine that this is your story. What would you feel? What would you, how this story would affect you? Okay. I hope it will work.
The pain started once I joined the military. I hyperextended my knee so it bent back. And so for most people, if that happened, you might say, it might hurt for a few minutes and that was it. Well, I've had pain in that knee ever since. Other times it would just be random. You know, all of a sudden I started having this really bad elbow pain. I started to wonder if maybe I was just overly sensitive to pain, that, you know, maybe the problem was with me. Because I would tell people, even people who knew me, and they'd say, oh, you know, last week it was your elbow and this week it's the so-and-so. I've had members of my family who just, you know, oh, she's a hypochondriac, you know, it's always something with her and that kind of thing. So I ended up shutting down to the point that I just stopped talking about it. Because of those issues, I became depressed. And so a lot of doctors, if they see depression on your list, well, that's the reason. You're in pain because you're depressed, not the other way around. I was misdiagnosed with various things for almost 30 years. Spinal stenosis, osteoarthritis, facet joint disease. Later on, I got a diagnosis of fibromyalgia. At first, I thought, oh, okay, well, that's it. Even though I felt like some of the symptoms may not necessarily have fit.
Okay, that's all. Is there anybody who would like to share what did you feel imagining that this is your life? This is your story. Oh, thank you.
Yeah. So for me, the most striking part of that, and when I was imagining myself, was this aspect of, let's say, like, you know, gaslighting. So it's I'm bouncing back and, you know, forth between me thinking that there's really an issue and nobody understands me, and me questioning myself, is there an issue? So this was a striking part of this narrative. And I think that, you know, she also kind of touched this part. So, you know, it's not very difficult for you to really start deeply questioning whether you really, you know, experience the things that you actually experience and stuff like that. So, you know, when the social reality is abandoning you, you feel like the whole reality is abandoning you to some extent. So I think that it's a it looks like a very difficult experience, and I can definitely feel, you know, I feel it right now to some extent when I'm thinking about it.
Yeah, thanks. Thank you. Yeah, so the others are writing frustrated. It's very sad when feeling your symptoms turns into a self-story. I'm overly sensitive. Yeah, because the environment, right? The family members, the doctors are saying it's nothing wrong with you, right? So yeah, maybe I'm too sensitive. Yeah, the mind is trying to explain what is happening, to name it, to explain it. It's unbelievable. Is there anybody else who would like to share? Because I cannot see all of you. I have this strange view now when I share my PowerPoint. Nobody? Okay. That lady, she suffered from the disease, and this is unbelievable. because she searched for the diagnosis for 30 years, and her disease was the same as her father's. But at that time, it was thought that this disease is not affecting females, and this disease is not affecting, They found a special gene, which is the risk of this disease is higher when you have this gene. But the problem is that Afro-Americans, they don't have this gene, but they can have this disease because it's not 1-0. So even she had her father struggling with this disease, nobody had an idea that she could have it. Yeah? That's really sad, because it would lead, just looking at her father, that she can have the same disease. The problem is that females and males, they are affected in a different way, right? So her symptoms couldn't match maybe exactly with father's, but it's the same disease. Okay. Okay. And what we can see also in that story, which I want to focus on, is that she had symptoms and she was depressed because of them. And the depression was blamed that she has symptoms because of the depression. So it is inverse cause effect. And this is so sad, because if you have really serious symptoms, and this disease is very painful. It's one, when you make the measurement, it's one of the most painful diseases. So if you suffer so much and you don't get help because there is no diagnosis, everybody would be depressed. So it's not a surprise. But when she felt not okay, oh, this is the reason you feel the pain. Yeah, this is depression. And this is very sad. And there was one thing she said, they thought it's fibromyalgia. And she said, but the symptoms doesn't fit. So we can see there is no trust in the symptoms, in the patient who is saying, okay, but it doesn't fit, but nobody listened to her. Right? Who cares? It looks like fibromyalgia, because now they are inventing tests for this disease. So before they didn't have, so it was like, oh, maybe it's fibromyalgia because we don't know what is wrong with you. Okay, let's go further. Example of a delay, autoimmune diseases. 1 in 13 suffer from autoimmune diseases. 80% of them are female. So it will be around 1 in 5 women suffer from autoimmune diseases. So it's not rare. Patients with serious and common autoimmune diseases spend average 4 or 5 years seeking diagnosis, and they see 5 patients. It is American statistics. And nearly half are told they are chronic complainers and they are too concerned about their health. Yeah, so from this 80% of females, half of them are hearing this. Let's go to another subject, rare diseases. Who cares? It's rare, 1 in 2,000, who cares? And sometimes it's 1 in 100,000 because there are that kind of diseases. But when we see them together, it's thousands of diseases, and the probability that the single person has a rare disease is high, 1 in 14. So it's like a trap, right? Because the doctor says, oh, it's a rare disease, but it is very possible that that person who is not diagnosed is searching for help, right? Psychotherapy, psychiatric help, because she suffers, he suffers, they suffer, and they need help. Average time to diagnosis of a rare disease is around 7-8 years. Session of doctors, eight doctors, but the majority is not diagnosed. Yeah, so we don't know what is the number of the people who are not diagnosed. 25 of patients with relatively common rare disease in the European Union waited 5 to 30 years to get a diagnosis. And 40% of them were misdiagnosed and they had incorrect treatment. I will show you another film about the rare disease.
Not having your symptoms believed is anguish. It messes with your head. After a diagnosis, disbelief can become deadly. My name is Beatrice. I'm an artist based out of New York City, and I live with a chronic illness that attacks my vision. My disease is rare, which puts me in a situation of having to advocate the parts of the system that what I have is possible, and the disbelief comes even from some doctors. I first started noticing that there was something about me that was kind of wrong when I was 16. One night when I was at work, I realized that I couldn't really hear out of my left ear anymore. I went to the doctor, who recommended that I get a cochlear implant surgery. Whether or not that was actually what was wrong with me, they couldn't say. So I decided to live with the hearing loss. When I was 18, I moved to New York to study fine arts at the Cooper Union.
I'm just thinking about the composition a little bit.
About 6 months into moving to New York, I started to have other symptoms. My joints got stiff. My fingers had lesions all over them. I went to the emergency room. They diagnosed me with MRSA and gave me antibiotics and sent me home. Later, I found out that there's actually a test for MRSA, which they didn't do.
100 mils left.
Once I was given antibiotics, what was a small set of lesions on my fingers quickly became a huge set of lesions on my wrists, my elbows, my knees.
Like a little extra resin.
That's when I knew that there was actually something probably very wrong. I went to go see another doctor. He put me on oral steroids and my lesions quickly disappeared. And within 5 days of being off steroids, they came back.
Now I have to make several phone calls to different doctors to tell them what's going on.
From there, I saw a series of well-meaning but incompetent doctors. I saw a series of cruel doctors who did not believe women could feel pain. One doctor thought I had HIV. Another told me I should stop worrying and get a boyfriend. Another denied me treatment, and I later found out that he was arrested for negligence when a female patient died under his care. They all seemed to agree, however, that I was just too young to be sick.
Monogrammed pill cases. They so specifically targeted it to me.
Are you sure this isn't the chemicals that you're using in the studio when you're making your art? This must be psychosomatic. You know, maybe you should see a psychiatrist. Then one day I went blind. It took my blindness for a doctor to take me seriously, and finally at 21 I was diagnosed with prion, an extremely rare disease.
The taxon was 24th of January.
Yeah, that's enough. What we can see is that she was lucky. She was diagnosed after 5 years. And she was lucky because her symptom was really serious. She lost vision. Wow. Imagine if she wouldn't lose her vision for more than 5 years, she would just search and be told to find a boyfriend or whatever, right? So the main thing is that the patients are not believed, and that's horrible, right? The doctors, they want proofs, and you cannot measure pain with a pain meter, for example, right? So that's one story. Another example is Ehlers-Danlos syndrome. It's a genetical hereditary disorder, and it has many, many types, but most of them are, the symptom is hypermobile joints and the loose skin. This is what you can see. But the problem is that some of those people develop comorbidities, which are really serious and devastating. For example, gastroparesis, which is horrible. Those people, when they eat, the food stays in the stomach and the food doesn't go further. So can you imagine, you eat and the food stays. After some time, you get nauseous and you vomit because you have to get rid of this, right? If it doesn't go further. And this symptom can make those people starve to death because the autonomic nervous system is damaged and the digestive system doesn't work correctly, right? The movement of the digestive system. The disease is 1 in 5,000. It affects mostly females. And look at the numbers: 14 years delay from the first symptom to diagnosis, 16 years for females and 4 years for males. So if we think about somebody having this syndrome and searching for 16 years for the diagnosis, that person for sure needs help, right? Support, therapy, and to be believed. And what? 56% from all of them was given misdiagnosis, and of those misdiagnoses, 20% was psychiatric ones. Yeah, it's all only in your mind that you vomit, for example. I will share the last film. I'm sorry to make you a little sad about this, but those are sad stories.
I'm Caroline, and I'm the mum of Ellie, who is the most strongest, inspirational girl that I could ever wish to have been a parent to.
So, hi, I'm Ellie, and I'm 17 years old, and I have hypermobile Ehlers-Danlos syndrome. I received my EDS diagnosis when I was 14 years old. It's been a rough ride. I've suffered a lot of mistreatment throughout my life, and even now with my EDS diagnosis up to present day, I still suffer from medical professionals, psychologists who just do not believe in the condition and are not even willing to listen and learn. I've massively suffered mentally and emotionally and physically as well with what I've gone through. We've had three accusations of fabricating induced illness. So basically blaming my mum for my medical issues, and also having everything blamed on me with eating disorders, psychological problems. So it's been blamed, my physical issues have been blamed on everything apart from the actual issue, which is EDS. So this year I eventually got a diagnosis of postural orthostatic tachycardia syndrome and mast cell activation syndrome after years of mentioning these conditions, as I was very symptomatic of them. So I'm 17 now, turn 18 in May 2020, and we'll be going into adults then, and I just
I'm Caroline, and
okay. That's, I think, enough for you to watch. Yeah, so you can see again. Okay, there was something I wanted to show, but
Ellie,
I don't know
who
how to
is
move.
the most strongest inspirational girl.
Okay. Okay, it's not easy to change because I wanted to show you another part of this video, but when there is sharing, I cannot do that. But there is, I will just tell you shortly. The mother and the daughter, they discovered that they cannot mention any psychological problem of the daughter because when they mention it, it's a trap and they will not do any further test and they won't help her. So they learned through those years not to mention, right? Because of course she had psychological problems. She couldn't go to school for her life. She was staying home. So this is not a normal life for a young girl. And she suffered, right? It was a very bad environment for her, very bad life. And they noticed that they cannot mention anything that she's sad, she's crying, or whatever. It's after many years, they knew the strategy, how to cope and to get medical help, right? I'm sorry, I didn't know how to move to that part of the film, but it's also very, very devastating that they couldn't find psychological help openly, right, to ask for it, because it would mean that everything what is happening to that girl is psychological, psychosomatical. If there are any comments, Bartosz, please let me know, because I cannot see the chat. Okay, so when the doctors, family and friends do not believe you, what is happening? First of all, you are not able to say what body sensations are normal and what is not. For example, endometriosis, painful periods. The girl gets first period, it's painful, and she said it's normal that the period is painful. How she can compare her pain to other person's pain? She doesn't know. So she thinks, okay, everybody suffers. So what happened next? She's learning to ignore body sensations, because if it's normal, let's ignore it, right? And those people, they push hard to live with it. And they feel lonely and abandoned. And they avoid doctors. And they are not felt accepted by friends and family members, so they also avoid other people. So loneliness is a huge problem for that kind of people who are not diagnosed. Usually it ends with depression. And those people lose the support. When we look on the groups of undiagnosed patients, we can see there is one group that they go to the doctors and they are told there is definitely something wrong with you, but we don't know what, but it is. So they are believed. There is another group, and those who are told they have psychosomatic symptoms. So they're not sure if it's not their fault they have it. Yeah, and they still don't know why. Yeah, what is wrong with me? And there is the last group who are not believed at all by anybody. And as this triangle, it shows the suffering burden, right? That the biggest burden is for those people who are not believed. How much time do we have? We have. There was an interesting experiment. Perceivers watched the film with patients moving arm, and it was painful because they have chronic shoulder pain. And they were asked to judge if they need psychotherapy, do they need painkillers. And perceiver judged female patients are relatively more likely to benefit from psychotherapy, and male patients for pain medicine. I will not comment it. I don't think it needs commenting. And another thing, I don't know, but in Poland and with people who I talk to, psychosomatic is understood that it has a root in psyche, so in our soul in Greek, but it means that it is caused by mind, by stress. And this is the old definition. And it changed. For example, and I will give you an example of stomach ulcers. Stomach ulcers were for decades treated as a stress-induced disease. And people were told to relax. They were sent to places, in calm places, avoid stress, avoid anything, live your life slowly because you have stomach ulcers. That was the treatment. But surprise, there was a person who discovered bacteria which cause ulcers in stomach. And you can treat bacteria giving antibiotics, and people were cured. And stomach ulcers are not psychosomatic disease anymore. So it seems that before, psychosomatic was, we don't know how to cure it. We don't know what is causing this, right? But the new definition of the disease is a little different. Soma in Greek is body, and psycho is soul. So true thing is that this is a somatic disease, but stress elevates the symptoms, right? So we still have to treat real disease. It cannot be treated only by psychiatrists and psychotherapists. Of course, it can help, but it is not the case. If you have a headache and you have a very relaxing day and the headache is not so strong, you can have a very nice day and you don't need any painkillers. But if you have, for example, today I have a presentation and I have a headache, I did it, but imagine that. For sure I would take some painkillers because this headache will make me a very bad lecturer. So stress, it's completely natural that stress elevates our symptoms. High pressure, it's a disease. People, some of them, they have problems with high blood pressure and they can get stressed and the blood pressure is going higher, right? And it's completely normal to the stress, but those people have much higher measurements. So this is a typical psychosomatic disease. They already have the disease, but the stress elevates their symptoms. I think it is quite important to mention that because psychosomatic is not only psycho, right? It's not only the soul that is suffering. Let's talk about the acceptance and commitment therapy. Because I work in ACT, I know how it helps and how it works. And most of the therapists, they use mindfulness, being in the moment. So they stop their clients or patients. They teaches them to be open to the experience. So this is very important. It really doesn't matter if the disease is real or not real, but experiencing what is in the moment is very important. And there is also work with uncertainty of thoughts, right? The thoughts are just the thoughts, and the mind will try to name it. Is it hypochondria or not? Is it disease is real or not? Am I seriously ill or not? And the person can be taught to treat it lightly, but what is in the body is in the body. So the body doesn't lie, and all sensations are real. And we can do this ABC behavior analysis, right? So, for example, there is a symptom, and there is a coping behavior, and there are consequences. And some coping behaviors can be not towards values, right? Not the good ones from ACT point of view. So we can track what the person is doing when they have somatical symptoms. I want to emphasize exploration of the body sensations because it's really important for those patients. As I told you before, some of them, they learn for ages to ignore the body because it's normal, there's nothing wrong with you. So the best strategy is just to ignore. Therapists can teach to be open to the body sensations. They can also, when they stop at the body sensations, the patient can learn precise descriptions. What is really happening to the body? Is it burning? Is it constant? Is it changing? So shifting the attention towards the body helps patients to know what is really happening. And if the symptoms are severe, they maybe will be motivated to go and seek medical help, right? Because for years they were learned to ignore. Yeah, psychological flexibility. This is triflex, but it can be hexaflex. Psychological flexibility will not heal the patient, for sure. But the side effect of the psychological flexibility is that the patient can lead a satisfying life, valued life. And the patient can learn not being hooked by thoughts and feelings. And remember, those people, they have many thoughts and feelings, right? There is a lot of stuff to be diffused from. It took ages for some of them to develop stories, to be cut by mind. So ACT can help them tremendously to live their valued lives. I'm going to mention one tool which you can use with patients who have some somatic symptoms. You can ask them, and I think some of you as ACT practitioners use some kind of table that you make this ABC and you check the symptoms. I call it symptom because I'm talking about medical symptoms, but it can be emotional, whatever is happening, and then how to deal with it and what are the consequences. So this table doesn't have one row because it doesn't show the consequences, right? So when you ask a client to do this table, write down the symptoms, how they are dealing with this, and what are the consequences. And you can just see if that person is going towards the health value, for example, right? Are they choosing some other values in their life, or are they just avoiding something? So we can check it out. But this table, we can make it smaller without consequences and ask them to give it to the doctor. Usually I ask to make this diary for 1 week or for 2 weeks. And then we can distinguish, let's back to the doctor's appointment. If you have many symptoms and you want to tell the doctor all the symptoms you have, it will take half an hour or more to describe it. And still the doctor will not have a picture what is really happening, how often, because One person can have nausea once a month for 5 minutes. And another person can have nausea every day for 5 hours. So that kind of diary can show exactly what symptoms are coming, how the patient is coping with this. Did they drink a lot of alcohol before and then the next day they are nauseous? Everything can be followed, and the doctors take seriously what is written. So it's a great tool to help our clients, patients, to get good help from the doctors. It really works. How can be undiagnosed patient in therapy? Well, when your diagnostics are delayed and your disease is rare, we know it. The disease does not give visible and detectable symptoms, right? There is no proof that there is something wrong. And the interesting thing is that the doctors are having, they have some kind of, there are some diseases that doctors think it has higher prestige and lower prestige. And this is very interesting because higher prestige, you have some examples here: leukemia, brain tumor, heart attack, testicular cancer. And low prestige, arthritis, AIDS, anorexia, depression, anxiety, fibromyalgia. What is the difference between them? First of all, as you can maybe already noticed, that high prestige diseases usually are lethal. Yeah? The risk of death is high, and there is a very rapid treatment and saving lives. Wow, what a story. Yeah, I'm not surprised the doctors think it's much nicer to, I don't know, to treat brain tumor, to make a surgery, to save lives. And imagine those people after the treatment, they are completely healthy. Yeah, if they are lucky, of course. But yeah, healing, end of the story. And when we look at the low prestige diseases, they are chronic, they are boring. The patient is getting worse in time. Who likes to treat that kind of diseases? It's a torture. And some of them are even thought that they do not exist, like fibromyalgia. Or some of them, oh, depression, what is this? Oh, who cares, right? How to measure it. So as you can see, if the symptoms of the disease are connected to low prestige diseases, there is no urge to do quickly tests to save lives because it's a slow disease. It's not serious. You didn't die. Okay, you had a pain. You didn't die. So you can see it's a huge difference between those diseases. And the probability that you are undiagnosed is higher when you're a woman, minority, having mental disease, because of course this mental disease will be blamed for everything. If you are too young to be sick, if you look too good to be sick, and if you cry at the appointment, it means you have depression, so we can blame depression. And if you are too calm at the appointment, because it means symptoms are not serious. So this is how you can get a patient, undiagnosed patient on your therapy. Okay. And to sum up, what ACT therapists can do to help? And this is what you already said. Validate the experience of the client, that the client will not feel alone, will feel understood. Help to notice body sensations and symptoms. teach to distinguish from suffering from the pain, because you can feel the pain. And the mind will tell you so much things that there is a huge suffering as well. And I don't know if you had this experience, but we really can distinguish if the pain is only psychological or the pain is real. I don't know how to use this word, but if you manage to teach a client to stop on the body, to be open to the sensations, and to notice the thoughts that they cause this suffering, you can sometimes notice on the session that they, for example, they come and they say, oh, I have a back pain, right? Okay, let's notice what is happening to your back pain. Let's stop it. Let's name it. What is the pain? How does it look like? How would you describe it? And after that, what is your mind telling you about this pain? Oh, because I'm stupid, I have this pain, or I am always sick, or whatever, right? And what is changing when you have this thought? Is this pain stronger? Do you feel any difference? And you can continue and notice what is happening. And I have noticed that some of the clients, they notice that the pain is not so strong, right? It was just mind making this pain stronger. And this is how we can help with psychosomatic diseases, or the diseases which are really connected to more to the mind rather to the body because of the tensions, right? We can get tense with the stress, and then we have pain. But if the pain is still there and it doesn't change, and we teach a client to notice the pain, they will learn, they will see, oh, maybe it's really something wrong with me. Maybe I should search for help. What ACT therapies can do more to help to follow the value of the health and the body, how to take care of it. Yeah, we have only one body in our life. We can teach them to live valued life despite having symptoms, despite not being diagnosed. We can help to write a diary, as I suggested. It's one of the tools which you can use. And we can teach self-compassion towards the pain and other symptoms. Yeah. Okay, I think that's all what I wanted to tell you today. There is a joke, meme, which is very popular on the some groups and forums of patients. And I'm sure it is American meme because we have a very nice bill there in dollars. But what is happening there, it could be without the bill, right? You could go to in other countries having public health care, and you can get also the diagnosis, go to therapy. But it's good that the people who are ill, sick, they have sense of humor, diffusion. If you have any questions, you can write down them on chat, or just because we still have time. Yes, Bartosz? So if you
we have quite a lot of time.
Yeah, because the group is somehow, we made it much faster than I thought. Are there any people who would like to discuss whatever? I'm interested in your thoughts and feelings you had during this presentation.
I have one question. Do you, from your experience, from working with people who have some undiagnosed illnesses, while working with them, do you experience the alleviation of their symptoms, or do you only see that they are getting better with dealing with those symptoms? Like, what is your experience with those somatically suffering clients?
Very good question. It depends, of course. When somebody has this story of not noticing the symptoms, not noticing the pain, usually when we stop and we ask them to notice, to stop, to feel it, they are surprised that the symptoms are so strong. And they are surprised that they can describe it very in a detail what is happening. And they are a little surprised why I asked them to do so. And their mind is asking why we are doing this, right? Do I need this? I don't need to stop on my pain. And at the beginning, it can be like side effect of it, that their focus will shift towards the body sensations. So after the sessions, they will search, they will check, they will notice, and they will come back and say, oh, I have pain here or somewhere else, I feel like this. And at the beginning, the result would be, oh no, what I have done, why I made this patient worse. Now they are hypochondriac. But we have to remember that in ACT therapy, we teach them how to diffuse, how to find values. And the only way to do that is, first of all, to notice. And then when we know what we are noticing, we know where those thoughts which we have are pushing us. So when we notice them, we have a space to make a decision. Okay, I don't feel very well, but I can talk with my children today. I can give them attention, right? Because I love them. And before the therapy, they would rather watch Netflix, not to feel. So, and also when you notice the body, you can learn how to help the body. You can take care of it more. So you can even prevent other serious symptoms which can occur in chronic diseases and undiagnosed diseases. Because people, when they have space, they can learn how to deal with their problems. And those are experts, really experts, how to deal with it. Okay, if I have a plan to have a nice excursion next day, they know that they have, for example, saved their energy the day before to go to the bed earlier, to get much more sleep, to have fun, nice day next day, valued life, valued day, valued event. So they get better with the satisfaction from their life. And they feel the influence of the stress is little lower. This is the side effect, what I said after teaching them psychological flexibility. Yeah, but they get really better.
Yeah, just a remark here, like actually not judging by my clients, but by some of my friends, when they grow as people, as persons, through and throughout their own dealing with their own diseases, they can learn to trust themselves, because there are so many conflicting informations about what to do. When they are dealing well with that, they learn to treat themselves as experts, and they really can learn from their experience instead of relying on authorities or instructions, because they often fail them.
Yeah, absolutely, Bartek. Yes, and they, for example, with painkillers, yeah, the doctors, they usually give some painkillers, and they say how many daily, how often, what the dosage. And okay, but the person who is suffering knows the best how to take it. And when they are good carer of their bodies, it doesn't mean that they will overdose those medications. No, they will learn, they will see, they will notice, and they will do the best to have relief from the medication. They will notice that, for example, taking it for a night is not a good idea, or a good idea because they are not sleeping, right? Or they can make a break